COVID-19 is tightening its grip on the U.S. as the number of cases continues to rise. In the last 3 days, the U.S. has reported more than 671,000 new infections. Several states broke their daily case records yesterday. Hospitals across the country are trying to manage an influx of sick patients and a lack of staff during this latest surge. But as Nancy Chen reports, the results of new studies are providing some hope.
New research from several universities overseas shows that Omicron cases tend to be less severe. Health officials are still anticipating a spike in hospitalizations. Across the country, several hospitals are already overwhelmed. And in the New York area, nearly 20 urgent cares temporarily closed yesterday because of staffing concerns.
The sheer number of infection will cause an overwhelming for most of our hospitals.
Some hospitals are already there. The ICU in Michigan's Beaumont-Dearborn Hospital is at 98% capacity. The coronavirus accounts for most of those cases.
What is the fear of what could happen?
It's really the unknown. We are in a perfect storm.
Mary Ellen Coaches-Roulard is the chief nursing officer. She's now working alongside a team of U.S. military members sent by the government to help with staffing. One thing health officials say could help hospital staffing shortages: shortened isolation times after exposure.
If you are vaccinated and if you are boosted and you get infected, the virus may not be staying with you for a longer time, for 10 days, and we need you to come back to work.
3 federal officials tell CBS News the CDC will likely issue new guidance for healthcare workers about isolating after testing positive, potentially lowering the amount of time required to 5 to 7 days instead of 10 days. That guidance may ultimately be expanded to a larger audience.
We got good news today.
In a major milestone in the fight against COVID on Wednesday, the FDA authorized the first antiviral at-home pill to treat the virus. The agency found Pfizer's 5-day series of 30 pills significantly reduced the risk of hospitalization for those at risk of serious illness.
It almost certainly will be a physician writing a prescription for someone who within the first 3 days of notable symptoms of COVID and is in a high-risk group to get it.
The White House warns the antiviral pills won't be widely available for months and that the pills are not a substitute for a vaccine and only help after getting coronavirus. And with just 2 days left until Christmas, health officials are reminding everyone to take precautions, including wearing masks and getting tested, Jessi.
Nancy, thank you. Joining me now to discuss the latest developments is Dr. Amesh Adalja. He's an infectious disease expert and senior scholar at the Johns Hopkins University Bloomberg School of Public Health. Thank you for joining us, Dr. Adalja. New studies from Europe just came out. They suggest that the Omicron variant is less severe than Delta. One of them out of Scotland found subjects were less likely to be hospitalized with the Omicron variant than the Delta variant. I should note these studies are not peer-reviewed, but doctor, what do you make of them? Is the fact that more people are vaccinated a factor?
There's likely a lot of factors that are playing a role in what's causing this signal for decreased severity. It could be, yes, the population is much more vaccinated. We also have a lot of immunity from prior infection in place. And it also is who's getting infected. So if younger people tend to be getting infected in some of these countries, that could also be responsible. But these are signals that I think we have to take seriously because they're coming from multiple places: South Africa, the United Kingdom, Denmark. But in the end, if you're an unvaccinated high-risk person, you shouldn't count on those studies to say that you yourself are going to have a mild case, because we know that people have died from Omicron. They've died in Israel, they've died in the UK, they've even died in the United States. So this still can kill. And the fact is, if you've got a lot of people getting infected and crushing a hospital, it's still not a good situation, even if the mortality rate is down, because the hospitals are already strained in many parts of this country with so many Delta patients that are unvaccinated that it's going to be difficult no matter how you look at it.
And there are reports out there about symptoms that are specific to the Omicron variant. Does this strain of COVID-19 present differently than the others have, and what should people be looking for?
It does appear to have a difference in some of the spectrum of symptoms you get. It's still an upper respiratory infection, so you're still going to get a lot of overlap. But it seems to be that sneezing is something we hear more about, scratchy throats, more about that, less of the loss of taste and smell. So it may be also attenuated by the fact that many people are vaccinated and it's causing a different spectrum of symptoms. But there's still those cold-like symptoms that you see with any variant. But maybe there's a little bit of a skew here and less of the taste and smell loss that people were relying on early on.
Got it. So the CDC is looking into shortening its isolation guidance now for healthcare workers who test positive for COVID-19. Obviously, staffing shortages are a big factor here, but is that safe to do? How long is someone contagious with COVID-19?
It's definitely safe to do. We know that one-size-fits-all 10-day isolation period doesn't necessarily apply to everybody because some people clear the virus quicker, especially if they're vaccinated. And I think we can use antigen tests to tell when somebody is contagious and truncate isolation periods and make them really precision guided. That's going to help with the workforce. It's going to help with disruptions because even though these breakthrough infections are mild, they're disruptive if you have to take 10 days away from your job, away from your life. The NFL is doing this, and I think it's something that we can expand to the general population. We just need to make sure we have enough rapid tests to be able to operationalize it.
Right. So new COVID treatments are coming now, and that should help as well. The FDA approved Pfizer's antiviral pill for emergency use to treat COVID-19 yesterday. How does that different from the shot, and are there any side effects to the pill?
So this is something that is not a substitute for the vaccine. Prevention is always, always, always better than treatment. It's better to not even be in a position where you need this treatment. But this is going to be game changing because what we see in the data is that 90% of people who take this pill in the correct window period of time, 3 to 5 days after symptoms, are prevented from serious illness, hospitalization, and death. And that was in an unvaccinated population. So this is a truly remarkable way to think about treating this. It makes it, I guess it's more evidence that we're getting to a point where science and medicine are providing us tools to make this an easier virus to deal with. We just need a supply of those, and we're going to also need tests there because there is that window of time, so people need to know they're infected to even ask for this pill. And I think that there are going to be some side effects. One of the ones to keep in mind is that it is going to have a lot of drug-drug interactions. So doctors are going to have to review what medications people are on to make sure that there's not a negative interaction. But the side effects are kind of in the acceptable range. It's the drug-drug interaction that's going to make it a little bit more difficult to prescribe.
So this week, the president announced his administration would keep encouraging people to get vaccinated and give extra resources to hospitals to help with the influx of sick patients. He also promised to give out tests and ruled out another lockdown like we saw in the beginning of the pandemic. In your opinion, is the White House's plan enough?
I do think that shoring up hospitals is really an excellent part of the plan. That's what's definitely needed now today, because we know that many hospitals are inundated with unvaccinated patients that are making it very hard for them to operate. So this is going to really give them some relief. When it comes to the testing, I think it's great that the federal government is now recognizing the value of home testing, but a lot of this is going to come after this holiday crunch. I've been texting with people right now trying to get tests so that they can fly home because they've been exposed. That situation was predictable, and I do think it's another example of the failure of the government to realize the value of home testing, the value of rapid tests, and they've always been undervalued from the Trump administration to the Biden administration. Only now is this getting moving, and we're going to start to see those tests become more abundant, but only in January. That's going to help, but it's not going to help these next couple of weeks. And I would also like to see the president rescind the travel ban on the Southern African countries. That ban did nothing. It was ill-advised, and there's no reason for it to be in place at this point.
Dr. Amesh Adalja, thank you for your expertise.